And of course, some of it will have been from reporting, because as soon as you start to measure it, you are going to get increased ascertainment. So this is the trend in other bloodstream infections, many of them equally, if not more, deadly than MRSA. National initiatives, because we wanted to see what had been spent. And as I say, it's very unusual for the Department of Health to have national initiatives. Modern matrons, they were one of their 10 main responsibilities was improving infection control, improving cleanliness. They have had quite an impact in some trusts. Not always, but generally the view was that they had an impact. The Clean Your Hands campaign from the Patient Safety Agency, that actually has had some evaluation, which is quite unusual sometimes for these initiatives to actually have an evaluation, but the evaluation did show some cost-effective improvements in hand hygiene. The Saving Lives campaign, I don't know what you think, but actually I was very impressed with the Saving Lives campaign. Many trusts in 2000 told us that these infection control teams complained that they were spending all their time writing guidance. Couldn't understand why, seeing as the guidance that you needed should have been pretty similar across every trust. But that's what you were spending 30% of your time doing. The Saving Lives campaign actually did that for you. It brought together all of the expert evidence that was out there and identified a number of care bundles which, if you addressed, would start to improve infection rates. And I think the results do bear testament to that. The Code of Practice, I mean, this became a statutory responsibility with regulation and inspection, and that has definitely ensured that there's been board engagement in this issue. The improvement teams, by the time of our report, they'd been around practically every trust, and you told us back in our surveys that you'd found them helpful on average, and they cost about £3 million a year. The Deep Clean, lots of controversy about the Deep Clean. But when we went round trusts visiting them, the benefits were more than just improving the cleanliness. And of course, a one-off Deep Clean isn't going to solve the problem. But it was the decluttering that went with it. And it was the increased awareness of all staff of the importance of cleanliness that you told us had made a big difference. And many trusts said they were going to continue to do a Deep Clean on a regular basis. So again, some improvements there. And if you go around hospitals, they do look visibly cleaner, there's no question. The technology programme, the Rapid Review Panel, seems to have not had the impact we were led to believe it would have done, but nevertheless there have been a number of new technologies that have been approved and have been recommended from that panel. And then latterly, MRSA screening, which of course has only recently been introduced, and it's too early to assess, and I think the jury is definitely still out on the cost benefits of that. Overall trust level findings, real improvements, tangible improvements, improved leadership at trust level. Slight concern that if you go and visit a chief executive in his office, he can tell you what his number of MRSAs and number of C. diffs, but he hasn't got a clue about any other patient safety issues. So it has raised the profile with them, but slight concern that it's sort of distorted the sort of importance and the fact that this should be really part of the whole patient safety agenda. Resources have increased, compliance with a good infection control practice, hand hygiene compliance audits show improvements, but there are still barriers, and you, in replying to the NAO survey or infection control teams and chief executives, identified that there were still barriers to overcome, and not least the conflict with other targets.